Hello, my name is Dr. MarkAlain Dery, and I am the Medical Director of Infectious Diseases and the Chief Innovation Officer for Access Health Louisiana. You see me do these updates now for the past few months, and in conjunction with the leadership of the ACOI, and I hope that these messages are helping you keep up with the latest on COVID-19. I know many of you are in the thick of the fight, and I'd like to thank you on behalf of all of us who daily focus on things like infectious diseases, and certainly on behalf of the ACOI for all the amazing work that you're doing. I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section, and we are facing this once in a lifetime global battle, and I want to hear from you, my colleagues, who are experiencing the fight from their location. So no matter where you are in the country, I provide my contact information at the end of each update, so please listen for that, and I hope that you take me up on this invitation to reach out. So moving forward together with the ACOI, we would like to continue to share information with you as it becomes available, and as well as some hopeful news as that becomes available too. So let's start with our first story, that the Sunbelt has become the global virus capital. Think about that. So think about this sentence that I read today in the New York Times. Think about this for a minute. There is no country in the world where confirmed coronavirus cases are growing as rapidly as they are in Arizona, Florida, or South Carolina. The Sunbelt has become the global virus capital. So let's do away with all this brouhaha about warm weather possibly eliminating coronavirus. Obviously, that's out of the case. So I'd like you to see this chart that was published this week in the New York Times. It's eye-popping. It lists the world's worst outbreaks of COVID-19, and topping the list of the world's worst outbreaks are 3 U.S. states, Arizona, Florida, and South Carolina, and they were all counted as if they were their own countries, right? So, all right, so the chart is based on the number of cases per million residents in the last 7 days. Arizona is way ahead of the pack at 3,300 cases. Florida at 2,700, South Carolina is next at 2,300. Then next on the list is my state, Louisiana, which pops up at 2,000 cases per million. The only countries with outbreaks that are as severe as what we've seen here, like we just said, Louisiana and Arizona, Florida, and South Carolina, are Bahrain, Oman, and Qatar. 3 Middle Eastern countries with large numbers of very low-wage migrant workers who are not citizens, and these workers often live in cramped quarters, and many have contracted the virus. We've talked about this before here on this video blog, that frontline workers and poverty are some of the biggest predictors of coronavirus. So, coming back to our story, how can all this be? The U.S., which is the richest country in the world, has the worst rate of new cases and is even ahead of countries where people are forced to live in unsanitary conditions. Well, for one thing, the rush to reopen states has been identified as a culprit. Places like Arizona were literally closed one day and fully open the next day. No phased reopening, no nothing. Dr. Fauci said on a live webinar today that was sponsored by the publication The Hill that places like Arizona opened up too quickly and essentially skipped over all the guideposts. And he also said that's not the way to go. I agree with him there. So Saskia Popskyy, who is an epidemiologist at the University of Arizona, and like me, her life has become completely consumed by the pandemic. I was an HIV doctor pre-COVID, and I am a COVID doctor, I think, post-COVID, maybe? I don't know. Anyway, in an interview she did with the publication, The Atlantic, she writes, or the writer wrote that the doctor's phone was continually buzzing during the interview. And, and this is really interesting. So the buzzing was indicative of every time a case was confirmed in the state at her hospital system. The doctor would get an email and her phone would buzz continuously. So this did not go unnoticed by the writer, and he called it a miserable metronome, ticking out the rhythm of the pandemic ever more rapidly as Arizona's cases climb. So my days are not dissimilar from hers, and I know how busy all of yours can be. Some of my colleagues worked nonstop during the height of the outbreak in the spring, 70 to 80 hours a week. We are not only advising policymakers and monitoring the pandemic's movements, but we're also studying models and the trajectory of the pandemic. We're working to ensure that hospitals are ready, and we're talking to journalists, and we're doing interviews, and we're creating podcasts, and we're doing video blogs like this one. So burnout for all of us in medicine is something that I also worry about, and my concern is the frustration and fatigue that can occur. So with this Sunbelt surge and other places in the country following, there's a real concern again now of physical fatigue and growing emotional frustration. Thankfully, the ACOI has been sponsoring sessions to help members discuss their experiences, and these are support sessions that are much needed because as physicians, we are not very good at taking care of ourselves. That's crazy, right? So if you want to be part of these sessions, which I actually, me personally, experienced a few months ago and thought was totally awesome and enjoyed greatly, I recommend you to please go to the ACOI website and sign up for them. They're really, really good. Okay, all this. My point is that the pandemic has become almost too much for the public to handle, so they're turning out, and as quickly as it becomes old news, this fades into the background. So, for the sake of our profession and the health of our healthcare workers, it should not become normalized, and it needs to be the top of our mind. And the big three, right? Mask wearing, social distancing, and I'm an infectious disease doctor. Hand washing are the best ways to proactively stay ahead of the pandemic and keep our health workers safe. So I posted a video today on my Facebook feed of Bill Nye, the Science Guy, demonstrating with a candle the effectiveness of masks. I've never seen Bill Nye get angry, but he does in this video, and I love how he's not afraid to demonstrate the seriousness of this issue, and as he says, it's a matter of life and death. And as I say, mask up, COVID down, mask up, COVID down, mask up, COVID down. All right, so real quickly, let's talk about some new and up-to-date testing. Saliva tests, which are interesting, that will help us, these new up-to-date tests will help us get ahead of the virus. And so these are important to talk about. So one of the keys in getting ahead of the virus is understanding that asymptomatic and pre-symptomatic spread of the virus is really quietly lurking as an underlying danger for transmission. So saliva testing to date hasn't been reliable, but some good news has come out of Arizona with a COVID-19 saliva test that has been designed by scientists at the Arizona State University. And this was designed to make university-wide testing feasible in the fall as the nation's largest university reconvenes. It's an alternative to the nasal, can you see that? The nasal pharyngeal swab, which are not comfortable because, it goes down deep. But they're also a danger to frontline workers. because we're administering those tests and people could potentially aerosolize coronavirus. But it also looks like this test can be more effective and cheaper to administer. The university at ASU is hoping to not only test students, but is also coordinating with the Department of Health and Human Services to open public testing sites soon. So this is good, and it's things like this. The antigen testing is going to be really important too once that comes out. But really, what it comes down to, everybody, mask wearing, mask wearing, mask wearing. We all have to wear masks, and if we as Americans can come together and everybody start wearing masks for at least 2 cycles of the incubation period. Incubation period is 14 days, so 2 cycles would be 28 days. If everybody could wear masks for 28 days, we would see rapid decline in virus. So with that, let me just say, stay on the lookout for our regular updates, and to read more from the sources that were used in this report, please go to, you ready? The ACOI.org /COVID-19. I got ahead of myself. Together with the ACOI, we will help you have the latest information to help you respond to your patients and stay on top of the crisis. Also, please feel free to reach out to me at madery@mac.com. Please stay safe. We can do this together.